have a conference committee to resolve those differences. Then there's one budget presented to the legislature. Both houses vote on it, and it goes to the governor. But a lot of negotiation goes on with the governor generally during that time. And usually we have a revision in May based on what's come in after April 15th, because you make an assumption about what the revenue is going to be, and then sometimes it's a lot less or a lot more. In the past 3 years, a lot less, even than the projections, because everybody's lifestyle's been going like that. This year was different. This year was different because the governor presented his budget in January, but he said, I want a budget passed almost instantly. So you have far less time to look at the issues about this budget. And the reason he wanted the budget passed instantly is because his budget was facing about a $26 billion, people call it a deficit, but it's really what you would call a structural difference. That is, here's the projected revenue, here's the projected expenditure, some of which is mandated by federal law. They give us money, never enough, and say we have to do more with it and put our own money to it. And so with a $26 billion deficit, he proposed a budget that was essentially about almost $14 billion in cuts, virtually all of them to Health and Human Services, and reserving a potential $12 billion cut more based on whether the people of California voted to continue a set of temporary small tax increases they had voted to allow, or was in the budget in 2009. And the reason that the governor, I think, said he wanted everybody to vote on it was that he knew darn well he was not going to get a Republican vote to pass the tax extension, because they had all but one signed a pledge not to ever raise taxes, and they think a tax extension is the same as raising taxes. So he said, I'm going to put it on the ballot, and therefore I want a budget very quickly. So we show the people of California we made the $14 billion in cuts, and if they don't pass this tax extension by the end of June, which is when the temporary taxes run out, then we'll have to cut another $12 billion, and it'll all come out of education. We tried to leave education a little bit unscathed, he said, but they will all come out of education. So that's what we were facing. As you know, the decision was made that it needed a 2/3 vote from the legislature just to put it on the ballot. The thinking was, well, that's not the same as raising a tax. We ought to be able to get a couple of Republican votes. That proved to be erroneous. And so there were no votes to put the tax extension on the ballot. And therefore, we're still stuck at the moment about what they're going to do about it. In the meantime, a budget has been voted on by the legislature and sent to the governor. And the governor has signed a number of the trailer bills that change the law made necessary by various things in the monetary budget already. And so I want to review for you sort of briefly kind of what it is and what may happen, although I really honestly don't know better than anyone, including Jerry. It's just, it's not up to any one person. People always say to me, well, what are you doing to get Republican votes for the budget? And I say to them very honestly, regular assembly members and senators do not get Republican votes for the budget. You don't go to somebody's district, and they're not feeling threatened in their district anyway, because they've made quite a case for how there's waste, fraud, and abuse still in the budget, though we've cut almost $100 billion in the past 5 years in the aggregate from the budget. So even Donna Arduin, when Arnold brought her from Florida to find waste, fraud, and abuse at the beginning of his term, couldn't find any, and that was 2003, and recommended that he simply cut education and health care, which is what every budget has done since. Now, the projection about revenue generally is a little more rosy this month than it was last month. It looks like we may be taking in a little bit more in state taxes, the current state taxes, than we expected. Unfortunately, our unfunded liabilities have grown, and it's not just pensions. Don't be fooled. Pensions are not anywhere near the cause of this deficit. The cause of the deficit, in my opinion, is the rapacious nature of what the banks did to us, and so many people lost their jobs. If they don't have jobs, they're not paying income tax. So many people lost their homes. If they lose their homes, they're not paying the same property tax, etc. So we may not have more to spend even if we take in more than we expected in April. So with a $26.6 billion budget gap, what we have done so far, and I say we even though I'm not there because I don't want to disassociate myself. I voted for bad budgets the whole time I was there. Already in the budget that passed and went to Jerry, deep cuts were made to higher education, which doesn't have the same Prop 98 guarantees that K through 12 and the community colleges have. Deep cuts to child care, very, very difficult cuts, including one which is still under review, and I hope we can reverse, that cuts across the board by 10% the individual amount paid for child care in institutional settings like schools, which essentially means they'd have to close virtually every program, including pre and after school programs, because you have ratios that are mandated by law. So if I have to have one teacher for all three of my infants, then if they cut what they're paying me per infant, I can't fire a teacher. I'm not just allowed to do that. So deep cuts to higher education, deep cuts to child care, deep cuts to health care for the poor and the elderly and for children, deep cuts in cash assistance to low-income children, because it used to be under our welfare program that we cut the money that went to parents, but generally a stipend of that is for the child's support. We have never touched that before, and they made deep cuts in this budget in CalWORKs, even for the money that goes to the children, and deep cuts in services for people with disabilities. The elimination of enterprise zones, which is different from redevelopment, that's still pending. They couldn't get enough votes for that in the legislature. The tax breaks that were given to the 10 highest or biggest corporations in California in 2009 at Arnold's insistence, and which were ratified by the voters in Prop 24 last November to maintain those corporate tax breaks just for 10 corporations in California, stay in effect. That was proposed to be changed in the budget. The way it works is the corporations get to choose whichever treatment is most favorable to them each year, and instead this would say, no, you have to do it this way. Couldn't get that through, so that's still pending. The elimination of redevelopment agencies, very contentious, failed by one vote, so that's still pending. So even those cuts that are taken into account in the governor's budget may not happen, which means it may be more than $12 billion that has to be found somehow by more cuts. If the taxes are extended, it does bring in about $12 billion in the year. So the taxes, for those of you who never knew or have forgotten, was a 1/4% surcharge on your personal income tax. It does not favor the rich or the poor or the middle class. It's across the board, which favors the rich. It's a 1% extra sales tax, sales and use tax, which you probably know, and that's a regressive tax as well, and 0.5% increase in the vehicle license fee, which we used to pay since 1941. We paid 2%. It was the only personal property upon which we paid tax, and Arnold did away with that. Realignment is not settled, and what realignment is services that the state provides now. They collect all of the money since Prop 13 and give it back to the counties and cities. We would assign the counties and cities to provide certain services under realignment that they do not now provide directly, or they do but with our direction, and give them some money to do it. But of course, in realignment, the problem is you have to serve a certain population by the law. If we give you $1 and your number of population goes up, still only get the $1. So it devolves really the problem to the counties. Now, in healthcare and health specifically, the governor's budget proposed a $1 billion shift from first 5 reserves all across the state on a one-time basis to pay for Medi-Cal services for children up to age 5. So essentially it takes the reserves, which everybody was saying, why do they have billions of dollars in reserve in all the first 5 programs? The answer was they've contracted sometimes as far as 5 years out for services, and you know, if you contract, you're supposed to save some money to pay for it, but the reserves look like a fat target, so he took it to prevent worse robbery in the budget, but it would permanently shift a certain amount of revenue in first 5 into Medi-Cal. The conference committee said, okay, $1 billion from first 5 reserves to Medi-Cal services for children up to the age of 5, this year only, but no permanent shift. We'll make the decision each year. So first 5 is made whole again from the tobacco tax. As you know, it's not a tax that would have existed except for Prop 10, and the money is supposed to go into first 5. Secondly, in Prop 63, mental health services, the budget, and the conference committee agreed, diverts about $860 million to state mental health programs in 2011 and 12. When you vote on an initiative, it normally says that the state can't back out the money so that the services don't get any more money on the new tax that you voted for. And so it's like they waived that, and we're going to take some of the Prop 63 money and use it for state mental health, which is what we're not supposed to do under the initiative for this year only. The third thing it did was in Medi-Cal, there were a lot of caps put in, so that utilization caps, which we have, but it's been made more stringent. Caps your prescription drugs at 6 drugs per month. There's a money cap for medical supplies, including durable medical equipment. There's a cap of 10 visits to your doctor or clinic per year. Now, all of that requires federal approval, and it's not clear that we'll get it at all. But the conference committee actually went further and reduced your physician and clinic visits to 7, but did not cap them at 10, and indicated that your doctor or medical provider at the clinic had to certify that an extra visit was medically necessary, or an extra visit or an extra visit. So it's not capped at 10, but after 7, you got to get a note from, mom. Co-payments are limited at are mandated by you as a Medi-Cal recipient to pay $3 for each generic drug as a co-payment each time, $5 for a name brand drug each time. You must pay $100 a day at the hospital as a co-payment. You must pay $5 for visits to your doctor, and you must pay $50 for an emergency room visit. All of which needs a federal waiver, but again, who knows? The really sad thing about it, of course, is because people with no insurance generally use the emergency room as their physician. But with Medi-Cal, theoretically, you shouldn't be using the emergency room just as your regular physician. And this was a notion that perhaps if people had to pay $50, they'd only go to the emergency room when they had an emergency and use their Medi-Cal insurance to visit a doctor for $5. You know, and it's a like all insurance, a behavior modifying device. Number 4, adult day health care was totally eliminated under Medi-Cal coverage, and this was one of the hardest hit populations. So when I say don't be old, this is part of the reason. The conference committee agreed to eliminate adult day health care as it was now constituted, but created a kind of narrower alternative program under a federal waiver, which I think the conference committee was thinking, we'll never get it, so we'll just say we'll do it if we get it, rather than eliminate adult day health care, because it would continue to be funded until there's a narrow alternative. But still. 5, reduced payments to Medi-Cal providers by 10%, which, as you know, the court threw out last time. The conference committee said fine. The court will probably throw it out again. 6, there was a kind of a very interesting approach, and I tell you this because I want you to see the people who serve on these committees as people like me or you, regular human beings who probably don't want to make most of these cuts, and who are trying to figure out how do you have a balanced budget without killing people. And it's not an easy thing. It's not easy at all. And so the conference committee established and this is interesting, I think, in terms of, again, behavior modification, a pilot project to encourage Medi-Cal recipients to take their medication. So reminder kind of issues, calls, visits, whatever. Because what they had found, of course, and you probably know very well, is that when people forget to or neglect to take their medications, their situation worsens and they need more expensive care. So, did you take your insulin shot today, etc. And so the conference committee established a pilot project to encourage Medi-Cal recipients to take their meds, or some alternative program that might be developed in 2012, not fleshed out. However, they gave the power to the Department of Finance to assess that if this pilot project or whatever alternative in 2012 did not save $140 million in the budget, then further cuts would be made to in-home support services. So what they were trying to do was to actually save in-home support services by creating a pilot project that they maintained would save enough money that they wouldn't have to cut IHSS as much. So there's a relationship there. But it is sort of brilliant when you think about it, and try to understand how people are desperate to try to figure out how to save some of this stuff. 7, no coverage for over-the-counter cough or cold medicine, and some limit to nutritional supplements, which I guess are vitamins. 8, they increased the premiums for healthy families in the budget, and the conference committee agreed. So families with incomes of 151 to 200% of poverty, and that's still very low, because I think the poverty level now is $12,000 a year. They go from paying $16 per visit for healthy families to $30 per child per visit. And families with 201 to 250% of poverty, the poverty level, go from paying $24 per child to $42 per child for each visit. So it's a big hit when you have a sick child. Again, this requires federal approval. So it's not clear at all what's going to really happen with Medi-Cal, which is really a federal program. Healthy families. We now will have co-pays in healthy families as well. $50 to go to the emergency room. Now again, you have insurance under healthy families. Theoretically, shouldn't be using the emergency room for health care. But $50 for the emergency room unless you're hospitalized, in which case you don't pay the emergency room, but you pay $100 a day for the hospital. They also eliminated vision benefits under Healthy Families, and all of us here wearing our glasses, many of whom may have had them as children, can understand that can be a real problem for success in education, etc. Very, and I don't mean this to be funny, short-sighted. 10, in-home support services. The budget, and this goes back to what I just told you about this pilot project that they invented, would have reduced all the authorized hours of service by 8.4%. That was the governor's proposed budget. The conference committee said no, this reduction only if the $140 million savings is not realized in the pilot project. The budget eliminated services under IHSS for anybody who lives with anybody else. The conference committee said no. So that's not in the budget anymore. The governor's budget eliminated services for those who did not get a doctor's certification that they must have in-home support services in order to prevent out-of-home care. The conference committee rejected that as well, although I didn't think that was so unreasonable, but the conference committee rejected that as well. So that's where we stand at the moment, and if you want some definitive answers, I can't give them to you because everything is so up in the air. Now understand the budget really isn't due till the end of June, but Jerry wanted it so that we could get the taxes on the ballot to secure that, because once the taxes that we have expire, the tax increment that we put in 2009 expires, we don't have that coming in. So that's, as he indicated, $12 billion. That less that we have if we haven't extended them at the end of June. So, of course, there's my conclusion. Stay healthy and don't be old and poor. And I guess one of the things that I like to do in speaking to people and hoping to get your questions about various aspects and things, and you don't even have to limit it to healthcare if you don't want, is to really understand what you're being told about the way things work in Sacramento is rarely true. It is true that Republicans will not vote for a tax extension or a tax. It is true that they generally all want an all-cuts budget. I must admit to you that though I was attempting for 14 years to be bipartisan as much as possible, that is, to try to get a Republican to vote for one or two of my bills, I've become much more partisan as I feel like their party has become so much more adamant. We used to sort of be swung around by our left wing many years ago, people said, and now I see it sort of being the opposite. The Democrats, there's a whole range of Democrats, the mods and the blue dog Democrats and all of this stuff. There's no left anymore. I'm as left as they get, and I'm too reasonable even for Tom Hayden. But it is an attempt to try to figure your way through a situation which is virtually impossible. It's made impossible by the requirement of a 2/3 vote to raise a tax, and now because of the other proposition that people voted on in November, 2/3 vote even to raise a fee, and fees are actually tied to things that they go to pay for. I pollute the river, I pay a fee to clean up the river, but now I need a 2/3 vote if I'm going to raise that. So we're really in a place where we can't structurally do very much to bring in more revenue without a 2/3 vote, because revenue, that's taxes. They call it revenue, it's a nice name for taxes. And we do not seem to be living in a time when people value community anymore. When people say, I understand that my tax is going, maybe in part, to actually keep poor people healthier. But to understand that you interact with so many other people that if they're not healthy, you're not going to be healthy either. That seems to have flown out the window. It's a very difficult time for getting these things done. So my answer, and I'll close with a kind of an answer, is really twofold. First of all, we have to change the electorate. And I don't mean just change their minds. I mean that more people who care about these things must vote. Because, well, take unions, for instance. Of the union membership in California, only 40% of the members are actually registered to vote. I don't even know how many vote. That seems to me to be totally ridiculous. Now, you can't mandate people register to vote, I guess, but seeing how people do not seem to understand the relationship between who's sitting in those chairs and their own lives, that to me is something that really needs to be kind of continuously talked about and pushed. Just voting. The other thing, of course, is that electorates are easy to fool. Abraham Lincoln says, or said, perhaps still says, wherever he is, you can fool some of the people all of the time. You can fool all of the people some of the time. You just can't fool all of the people all of the time. However, some of the people seem to be fooled all of the time about their own self-interest and are often doing things like voting to keep a corporate tax break, for instance, which they did in November. So changing the electorate. And the other thing I think is that a much more long-term project really has to do with seeing if there's anything to be done about bringing community back into the souls of Californians. In a tough economic time, that's a tough sell. First they take all the pensions away from people in the private sector. Then the people in the private sector have pension envy and essentially say, I'm not getting any pensions, why should they be getting pensions? And the answer is never, let's bring your pensions back. The answer seems to be, let's take their pensions away. And in terms of whether they're too big, let's say there are 500,000 people on pensions, and 114 of them are getting a lot of money. Well, that's what you hear about. But not about the regular people getting 30% of their fairly decent lower middle class or working class wages. And when we say the middle class has vanished in America, it's not a myth. And mostly it's devolved into working class or poor. So those are not answers for this year, but I do think these are answers toward which we must work. And that's it, and now I'm open for questions. Thank you so much for your invitation. Looking to my left, as always, I'll start and loud enough for them to hear if you can.
Yeah, I have a question about the Medi-Cal program right now. Even in your presentation, you talked about all these cutbacks in Medi-Cal for basically children and families, but I believe the majority of all medical expenses in California go to nursing home care. Eligibility requirements for nursing home care are not poverty level. What happens is that, for example, a married couple could have countable assets of $111,000. Many private attorneys right now are spending their time having people set up irrevocable trusts. If that didn't happen, and what happened with these cutbacks in in-home support services, adult day health services, people have no option but to go to the nursing home, and the cost of nursing homes has increased. There's more money for that. So it doesn't make sense to me when we talk about Medi-Cal, we always talk about the poverty population, but I think what's really true is that the majority of Medi-Cal goes to nursing home care, and poverty is not an issue.
I don't know what percentage of the money going to Medi-Cal goes for nursing home care. I was under the impression that it was not an available option for most people. And don't forget qualification for Medi-Cal. There's an income qualification for Medi-Cal.
No, actually, I'm an elder law attorney. So,
please.
And I first met you when I was a poverty law attorney with legal aid, doing health care. Right now, there is no income limit for nursing home care for Medi-Cal. It's totally different than regular Medi-Cal. They look at assets. Regular Medi-Cal, they look at your income. A family, for in-home supportive services, a couple could have approximately $840, I think, a single person $840, a couple $1,400. and their combined assets, a single person $2,000, a married couple $3,000. For nursing home care, your monthly income is irrelevant. And the reason it's irrelevant is because what you have would be used for your monthly deductible towards the share of costs, which is about $6,000 these days. In terms of assets, a single person has $2,000, a couple could have $111. Your home is not counted, your car is not counted, your IRAs aren't counted, and a lot of private attorneys now are specifically dealing with people who I consider to be high-income people to set up irrevocable trust so there'll be no collection.
Right.
I think that if you look at the per person amount that's spent on this kind of nursing home care, I mean, those same people who want to stay at home, if they had more sufficient in-home support services, adult daycare centers, the government would save incredible money. They'd be at home. But it's not even dealt with. I don't get it.
Well, I think that's one of the reasons that the conference committee wanted to try to preserve in-home support services.
They limited the amount.
But don't they, if you create a irrevocable trust, then that essentially is a way of
keeping your home so the
getting
government
your
doesn't
giving your assets away.
Yeah.
That is, you don't have
It's
access
a big issue now with
to your
private attorneys
assets.
and doing it with people so that you can get your Medi-Cal for
Right.
nursing home care and then keep your home.
I think it's very hairy in a way. I mean, I think the instinct not to want people to have to lose their homes instantly for their nursing care was a good instinct.
No, they don't count it.
No, I understand, but that's because the law says it's not counted. That's what I'm saying. I think it was originally a good instinct. I think the notion that I could give all of my assets to Liberty Hill, and that would not be the same as what you're saying in terms of an irrevocable trust, perhaps, might be a problem as well. Not for Liberty Hill, but, I mean, essentially I could give all my money away, and then I would be poor. And I'm not certain how you handle that under equal protection kind of issues.
I'm just wondering, how is it that our government has not tried to make it easier for people to stay at home, make more in-home support services,
I understand.
more adult
I think
care,
that's
all that
why.
stuff,
I think
and
that's
it's
why
not
they
there.
were trying to preserve the IHSS through a different process. Yes.
So kind of taking a step back and looking more at the macro Brown budget, just because you are incredibly well informed and here we tend to have this laser focus on health. Could you just speak briefly about whether or not health were really the only cuts, or what percentage of the cuts were there cuts to other things like transportation and the other thing, and the prison system, or anything else that the state government does, just kind of putting it in perspective?
Health took the biggest hits only because it's pretty much the biggest program. And except for K through 12 education and community colleges, which comes under Prop 98. And that, I think, is probably going to be whacked if we don't get that extension, which it doesn't look like we will.
Yeah, my kids' school, they gave half the teachers pink slips
Yeah.
for June.
Yes. Pretty much everybody, well, as you know, there's a requirement for a long period of time between pink slip and leaving for teachers. And so I think they've gone through it every year now for 5 years. I believe they've all gotten pink slips, but managed to save them. Now, it's possible that the increased revenue that they're expecting could save some of the school stuff, but I'm not certain what the decision will be made about saving any of the health stuff. Child care, honestly, took a huge cut. The CalWORKS payments to children took a huge cut. Prisons are generally not whacked as much, and that is not, you want to shake your head and say, oh, those prison guards, they get a lot of money. Part of it is in the, read Joan Didion's book. It's called Where I Was From, and it writes about California, because she grew up in California. There's a whole chapter about prisons. And it is true, once the Prison Guards Union was formed, many more prisons were built pretty much right away. But there was also this kind of law and order fever that overcame legislators in the 90s. And they could not trip over each other fast enough to get a new crime on the books or an enhancement for an old crime. And, if you use a gun in a robbery, you serve 5 more years. And it was, not to mention 3 strikes, which we voted on. And the thing is, when you have so many prisoners, I mean, there are no cafeterias pretty much anymore in prisons because they all have 4-tier bunk beds, and people have to live where the cafeteria used to be. If you ever want to really educate yourself, go on a prison tour. I'm serious. It's, it's actually, you say, oh, it's a lot cleaner than I expected, which is interesting. But the crowding, the overcrowding is just amazing. So in order to cut, you really sort of can't. You have a mandated guards per, number of prisoners. They already don't have health services, really. They used to contract with doctors, and maybe they do, but each doctor has 4,000 patients. So it's been mostly in health and education. Yes?
What happens next year and the year after? What's the scenario? Because the deficit isn't going to go away.
Well, we're going to continue to have a deficit if there's no revenue. Because unless, again, the revenue picks up normally. CalPERS, for instance, you may have read a study that showed that they were completely underfunded, the state pension system, for their pensions. Well, that was measured in 2009 when the market was at its nadir. In 2010, their investments gained back 50%. So they're not as underfunded as they were. They're still underfunded for the pensions, but it's kind of a moving target depending on investments. The main problem, I think, one of the main problems has been that the people of California have always thought that bonds are free money. And so if we put a bond on the ballot, because we didn't want to cut something, then everybody said, oh, bonds, that's good, that's great. And we pay a low percentage, but in these days to sell our bonds, we have to pay a higher percentage because we look insolvent. And so buy California bonds because they're paying a fairly high percentage. That's the good news to you. If you buy them, the bad news to the state. So I think we're going to continue to have this imbalance if we cannot.
What more can be cut, though?
Well, I think we have to put taxes on the ballot, and everybody is testing lots of different taxes. The tax to raise the state income level 1% on the top 1% of earners in the state seems to, of course, do the best in surveys, but it does bring in a decent amount of money. I think actually it may go, it used to be there. It was, cut, the cuts to people who earn more than $1 million or $2 million or $3 million have been very generous, actually. So they pay the same, essentially, as anybody who earns $150,000. In terms of a percentage of the margin, I'm sure you know there are different tax categories. We all pay the same on the first $1,400. We all then pay the same on the next, which is a little higher, $4,000. And it goes up like that until, your top earners pay about 9%. But that's a margin. They don't pay 9% of their entire income. They pay 1% on this and 2% on this, and etc. So 1% perhaps on people who gross more than $2 million, and there are a lot of people in California who do, that's popular. The oil extraction tax we thought was popular, but then the people of Los Angeles seem to have voted theirs down in November. I don't know why. So it takes a lot of people explaining to you somewhere on television why this is in your best interest, and I'm not certain there's enough to do that. First you, sir, and then you.
I wish you were back in Sacramento. Knock some sense into.
Thanks, but I never succeeded when I was there.
Brown has been criticized for putting a tax hike to the voters instead of just doing it himself. In view of the problems he's having getting the other side to back him up, do you think he might reverse himself and call and just raise the
He can't.
tax? He can't?
He needs a 2/3 vote from the legislature to put it on the ballot or to pass it. Either one.
Can't just bypass.
No way. It's a 2/3 vote to raise taxes.
Initiative process.
You gentlemen, yes.
Okay. So I think a couple of years ago or 3 years ago, the city of San Francisco passed, enacted their version of the universal health care.
Yes.
And I've read some interim reports last year. It seems like it turned out to be a moderate success.
Yes.
Do you foresee a likely scenario of this kind of a bottom-up city-level universal health care in California?
I think San Francisco is the only one that can do it.
Yeah.
And it's not because of their voters. It's because San Francisco is both a city and a county in the same geographic borders. So the city can impose a business tax. The county can deliver health care. In Los Angeles County, we have 88 cities. The likelihood of getting them all to impose a business tax to pay for health care is very unlikely. Yes.
Yeah, I have an unrelated question. I don't know if you've looked at SB 723, which increases the time for domestic violence offenders to be under restraining orders. Have you looked at that bill at all?
No, I haven't looked at any bills.
Okay. Well, I just wanted your opinion on it. It also limits their access to firearms then for 10 years. If it,
Well, I think that was the firearms bill was one that I carried. And
Right.
so Kuehl carried it again last year, I thought.
Yeah, but it didn't go in.
Right.
It's being introduced this year in the Senate, and it's increasing the
Yes.
restraining
It was
orders.
also a recommendation, I think, from the AG's task force,
Right.
back when Lockyer was AG. I agree. What's the length of time for restraining orders, do you know?
It
That's
goes up to
proposed?
10 years.
Yeah, I think that, well, I mean, I'm always fine with anything that limits people who've committed domestic violence. I was a pretty good vote on all of that.
Yes, sure.
I
We
think
need
that
to.
10 years, unless the offender's been in prison, is long for a restraining order. It doesn't feel long for a victim. But I'm talking about in terms of people seeing why they should vote for something and it sounding reasonable. So I'm not certain what chance that would have. But, you know, me, I'm for it. Yes.
First of all, thank you so much for all
Sure.
of your information. It was very informative. You speak a lot about messaging and about kind of getting the message across to voters. And speaking as someone in a younger generation and also liberally minded, it doesn't seem that there's really an option for us, messaging-wise. What would you see kind of going forward for our generation or for talking to our generation about the important messages? Because it seems that conservatives and conservative groups and their messaging is very solid, and the more liberal, be it Democrat, be it Union, be it anything, is so scattered, and there's not a coherent message for younger generations to grasp onto. And we're so big about having that catchphrase, having that thing to sign on to, which I think is why Obama was so popular, is because he had that. What would you kind of see for us moving forward from your experience, kind of like, you know, what would you see as like a strategy for getting our generation engaged?
Well, actually, I would say about 1 million of your generation are engaged in California. One of the problems is that Obama for America, which then became Organizing for America, OFA, did not commit themselves to various issues because they were required to really take their signal from the president and the president's advisors, because OFA kind of belonged to the president. So to take up the slack, there are a lot of websites, people tweeting, a lot of email generated every day in terms of information, a lot of messaging going around. You might sign up for one of them and then get all of your friends to sign up. You don't probably need any more tweets, but there would be a lot about it that would come to you, a lot more information than you probably would want. There's a woman in Venice, Marta Every, who has a site called Venice for Change, and it's not just about Venice, but there's a lot of doorways that open. My good friend Tori Osborne, who's running for the Assembly next year, has a young people's group, and a lot of them belong to different things. And I mean, you know, they're in more contact constantly than anybody I ever saw. So I do think it's going on. I just think that everyone is so atomized that you're sort of in your own kind of area. But you could probably find it through anybody through Facebook just by, you know, looking for any issue or message that you want, or go to Venice for Change and see where you might get information. Now I know that's individual, but still, I think it's a lot broader than you might think. A lot of people who were working with Obama, of course, working for Obama, are still in contact with each other. And their little pod that went to New Mexico, or their little pod that went to Arizona, is in contact. I think there is a lot going on. I can't always say exactly how to get in the middle of it, and you might be sorry, because you probably get 100 tweets a day now, you know, if you sign up. Yes?
No, I agree. I think that the discussion's there, but I think that the younger generation doesn't take it to the polls. I mean,
Yeah.
You just gave it the example with the union. Only 20% of people are registered voters, and if
Right.
you look across elections in general, the younger generation never goes and votes. The fire is there, the drive is there, the dream to have, you know, a future that works for everybody is there. People just don't. I mean, I don't know how you change that.
Well, I think that actually young people, because of Obama, and of course we have now a new campaign starting, or has started, I think they did, for the first time in their generation, get a sense about why government might be important, and why it might be important who's in government. And I find that this generation of young people, 15 through 35, actually feels like the government is the delivery system for equality. And that phrase is going around to a lot of places as well. Government is the delivery system for equality, or justice. You can put, whatever you want at the end. And there seems to be a lot more fire in people. Like Tori has a Sundays with Tori gathering every other Sunday at her house. About 50 young people show up. For the first hour, she says, ask me anything you want, because she's been a community organizer for 40 years. And the second hour is all to work on her campaign. So, she has a kickoff with young people. 200 kids show up, and it was fantastic. It was the best kickoff party I ever went to. So I think there may be this sense growing that government is a good thing, which the right wing is trying to unravel with this pension mythology. That government is not a good thing, that government workers are, greedy. And I think to counter that message, you need information, and that's why I think the connection is good. Can't really tell everybody how to get connected. Rick?
So Governor Brown said he wanted to go to the people, in part because he wanted to engage California in a conversation, a dialogue about what government delivers and why they should actually be willing to pay for it, rather than hiding the costs under the carpet or behind smoke and mirrors. And he's timidly started that, I think, going to a few Republican districts and a few other places. But clearly there's a need to engage the business community in this effort, and finding some business leaders who will speak to that issue. Why is investing in education so important to the economy in California, as well as to young people? And I think that Obama yesterday, in his speech, did try to create that frame of fairness to the poor, the old, and the sick, and investments in our future. And I think that that's a theme that at least the White House believes will resonate and bring people to the side of Democrats and against things like the Ryan proposal, which would decimate.
Well, the business community has not generally shown an interest in civic engagement or anything but lowering their own taxes.
But the LA Chamber and a few other chambers.
Well, the LA Chamber, if George Kiefer keeps beating them over the head, and maybe, Elise Buick and others from, like, United Way. But generally, business owners, small, medium, and large, are very focused on their bottom line. even entrepreneurs say, what am I, I'm trying to earn a living here. And you can't get a loan as an entrepreneur, even though, of course, everybody that loses their job then becomes an entrepreneur, because they have to earn their money somehow, and they've discovered, advertising, I'll do any services you need for $10 an hour, actually could bring in enough, to keep them alive. The business community has been very difficult because there have been, Patagonia and other forward-thinking business people. Even Steve Jobs a couple of years talked about how investment is needed, and the Silicon Valley guys. It doesn't resonate with business owners generally. Hoteliers don't seem to care. Restaurateurs. The only thing restaurant owners ever talked to me about was their adamance that they really wanted tips counted as the minimum wage. That was it. Everything, they wouldn't even talk about recycling food scraps, when I wanted to talk about composting or whatever. Anyway, we've come to the end of our time, so thank you very, very much for being here.
Thank you very much, Sheila. And our next seminar is on May 3rd, Tuesday, and we are going to have a group of speakers from Ben Gurion University in Israel who will be talking about privatization in a universal healthcare system, the case of Israel. So we welcome you all back then, and thank you again, Sheila.